16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening, friends. Welcome to the 150th episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jasila Mujib, your host for today's program. Happiness begins with health. In each episode of this talk show, we bring before you an expert doctor from Al Hilal Hospital to address your various health issues and to assist you in your journey towards good health. Today, the topic of discussion is gouty arthritis. It's a form of arthritis that can affect anyone. We have with us Dr. Badrinath Gumberla. He is an orthopedic surgeon from Al Hilal Hospital, Hith, with an experience of 12 years. Let's welcome doctor to the show and move on to the topic. Hello doctor, welcome to the show.
Thank you.
And thank you for being with us to discuss this very relevant topic.
Thank you.
So our topic is gouty arthritis.
Yes.
So doctor, what is gout and what are the symptoms of gout? Can you explain please?
Okay. In our normal understanding language, any inflammation of the joint because of uric acid and deposition of monosodium urate may lead to inflammation and pain swelling of the joint. This is simply known as gout in our normal language. Scientific definitions are a little bit different, but as a for a purpose of understanding, I am simplifying in a simple language. It's because of uric acid leading to joint arthritis. Okay. So it's very common in Bahrain especially. I get many patients of gout.
Okay.
Almost per day around 5 to 10 patients of exclusively suffering with gout.
Gout.
Okay. So that's the reason I choose a topic of gout, so that I can give more awareness to the public about the gout and its consequences, diagnosis, treatment and all.
So can you explain the symptoms for our viewers?
Yeah. So there are actually many types of presentations for gout patients. It starts from young age, middle age, old age also. So it depends. The symptoms depends for any wrist pain, hand pain, foot pain, etc., etc. But most commonly, the patient comes to my OPD with foot pain.
Okay.
The previous day they will be very normal. They don't have any injury, any fall, nothing. All of a suddenly, the next day, when they woke up from the bed, all of a suddenly they will get severe pain, unable to stand walk. That is very common presentation. So they don't have any injury, any sprain like that also, nothing. That's very common presentation. Usual age will be around 20 to 50 years.
Okay.
So it's not that other age groups are not involved. Most probably they will be around 20 to 50 age group. Probably middle age or just younger age group.
Okay.
So they will be having recurrent episodes like this. Male are more prone. The other type of presentation apart from foot pain is knee pain. They may get, it's like they will get specifically in only one joint. Even they, many joints are involved, but they usually present with all of a suddenly hand pain, wrist pain, elbow pain, knee pain with swelling, foot pain with swelling. So there are many types of presentations. It depends on patient to patient, and sometimes we may have multi-joint involvement, like there will be pain in hand, foot and all. There will be some nodular swellings in the hands, feet. So like we call it as some tophi in gout, for which there will be some stone-like formation in the joints. Okay.
Okay. The pain is the main symptom of
Pain is main symptom.
severe pain.
Yeah, severe pain.
In the joints.
Yeah.
Okay. Doctor, how does a patient come to your OP department?
So patient comes as if it's broken. I mean, the pain will be such severe that it's probably they may feel that it's broken or something like that. So there are different modes of presentation. The presentation what I told will be they don't have any history of injury previously. They come all of a sudden with a joint pain and swelling. The other mode of presentation is they feel that they have a sprained foot and all. Some patients will be diabetics. Some patients will be having a mild injury. They feel that they have some sprain or ankle fracture, but it will be like presentation will be gout only. So some patients for diabetes they will be having infection, like we call it as cellulitis. Okay, it also mimic gout only many times. So we feel that it may be because will be still be sometimes difficult to diagnose whether it's in gout or septic arthritis or cellulitis like that in diabetic patients especially. Okay. So we usually take history. Based on history, first we will come under some conclusion about gout, whether it's gout or whether it's some other arthritis. It depends on the presentation, and following that we will add some necessary investigations like X-ray or blood test like that.
Okay, since you told about the symptoms, doctor, what are the causes of gout? Since it is a concern now, so our viewers would like to know about the causes of gout.
Okay. So there are multiple causes actually. It's like just balance of the uric acid.
Okay.
Suppose if there is input, more input to our body of uric acid, naturally we can precipitate with a gout.
Through food,
sometimes, suppose if you take some more protein foods, especially like red meat, fish and all, sometimes if you, we call it as exactly purines, it's not proteins actually, purines. Whenever there is excess of purines in our body, while they are metabolized, so they will be converted into uric acid, that may deposit on our joints and cause pain. Okay. Other thing is, even though sometimes uric acid in our body, it eliminates through urine. If at all there is mismatch, like it's not going out from our body, it's not being eliminated in our body, then we can get all of a sudden this type of uric acid deposition in the joints and pains and all.
Okay.
So it's like mismatch, we can call it as. So there are some genetic predisposition also. So all things look similar, but there will be genetic predisposition. Sometimes they are more prone. And all the times we can't say that only uric acid levels are high, that's why we are getting gout. Even though for gout patients, uric acid levels can be normal.
Some other reasons are those therefore
can be normal.
Okay. Doctor, please explain the test to be done to diagnose
Yeah.
Because,
So this is
how
actually
do you-
a broad topic. How we diagnose it depends on
Yes,
the first relevant thing is history. History is very much important for us,
Okay.
and how they presented, and it will be like once they get pain, people who tends to do massage with the cream and hot fermentation,
Yeah,
which will totally aggravate your pain and complicate.
Okay.
Sometimes even doctors will be under doubt whether it's a gout or infection like that, because I mean they'll be the usual presentation is they just don't come with only pain. They'll do all these things with massage and hot water fermentation, which will cause severe pain, sometimes infection also.
Okay.
So based on history and what they did and all, by first give some conclusions, we can call it as differential diagnosis exactly. We'll rule out with some 3-4 causes, and we'll be searching for that cause. Whether sometimes there'll be small fracture or small sprain or foot fractures. So our first investigation will start usually with X-ray. X-ray doesn't mean that we can diagnose gout with X-ray.
Yeah.
So if it is like a recurrent gout, some joint damage will be there, or if it is like small fracture, to rule out the other causes, we will perform sometimes X-ray.
X-ray.
X-ray, and some investigations like uric acid and complete that picture, CBC counts, ESR,
Blood test also
CR.
there.
Yeah, some, because if at all any infection is there, then we have the total counts rise also.
Okay.
So there are some investigations like ESR, CRP, which will differentiate between the infection, gout, or other, like rheumatoid arthritis also one possibility for this type of presentation.
Okay. So you have to rule out the other
We
causes.
we have to rule out the other causes also. Sometimes for gout patients, it will precipitate because of some medicines actually.
Oh yeah. Okay.
Suppose some diuretics are there, which we usually give for hypertension treatment. So if they are on more diuretics, so
may cause gout?
Yeah, it may cause
Is it?
gout.
Okay.
So we need to see that thing also before starting any medication like that. And especially for the diabetics, there are some high risk individuals who are more prone for gout. First is, I mean, obesity, diabetes, and like any family history also, if at all any gout episodes are there previously. So like males are more prone actually.
Okay.
So diabetes also one more possibility of having recurrent episodes of gout. And
So many causes are there.
yeah, many cases are there. It's not like it's not a simple. We feel that only because of more protein intake we are getting gout. It's not always that. Okay. Sometimes, mostly there is some problem with the elimination of uric acid from our body.
Okay.
So many people don't take much water. So
That also reason.
hydration is more important. We need to take lots of water to flush out the uric acid from our body. So that's all very important. In this dehydration, I mean, in this hot summers and all, it's better to take lots of water.
So if a person has uric acid, how can he manage it in his life?
Yeah. So management comes under different types. Like first thing is for management, first drugs of choice will be NSAIDs. NSAIDs means we call it as some usual painkillers what we give usually. Okay. So there are some steroids also we give, like cortisone or glucocorticoids what we call it as. Some uric acid lowering drugs also are there, which we give. Its main problem is it depends on the severity of pain, at what medicine we can give to make him better. So if it is mild pain, we can start with a normal non-steroidal anti-inflammatory drugs. If it is like severe pain, sometimes we will start with a steroid. There are some indications for painkillers, because if some patients have some allergy to any painkillers, then we don't prefer NSAIDs. Then we can give steroid or something. Yeah, sometimes. Okay. Sometimes, suppose if at all any knee pain is there with a lot of effusion, we take some fluid out from the joint and send for tests.
Okay.
So that's all is some like and diagnostic part, and laboratory will send some fluid to test. And sometimes we give steroid injection inside the joints also. So when infection is rolled out, and if it is patient have severe pain, recurrent episodes, we can give you some oral steroids as well as injections also. There is some medicines known as xanthine oxidase inhibitors, okay, like we call it as allopurinol or febuxostat. So these will reduce the level of uric acid that we can give as maintenance dose. So yeah, management. Suppose if we have high uric acid levels, main problem is people only take medicine only for short course and then stop.
They stop. Okay.
They will again get recurrence. So patient needs little bit of education. So to prevent what we should do and all. The main problem is suppose the uric acid levels are normal, though still the patient has gout. We only give for pain management for few days, around 10-15 days, and we can mostly stop. Okay. If the uric acid level is too high, then we give some uric acid lowering drugs like xanthine oxidase. That will extend for around 2 months, 3 months sometimes. Okay. Suppose if the patient has stones like uric acid stones on the kidneys or in the joints, in joints we call it as tophi. So for the one tophus to dissolve, it will take around minimum of 6 months to sometimes 2 years like that.
Long duration.
Long duration.
Okay.
So that we call it as a chronic gout.
Oh, yes,
there are some complications of gout. It's not like always it will come and the pain will come and go. So you get sudden inflammation. If it is too much recurrent, then we can get a joint damage also.
Is it? Okay.
Yeah. So that will be seen in X-ray whether it's joint is damaged or not, like that. So sometimes they get for deformities. So we'll have some tophi, we have uric acid stones. These are some complications of excessive uric acid in the blood. Some patients without any symptoms, they manifest sometimes. Occasionally, when they go for any blood check, there will be more uric acid levels, hyperuricemia, what we call it as. If they don't have any symptoms and all, we only give some uric acid lowering drugs
for them.
There are some different studies. Some will treat it as an asymptomatic gout. So we don't suggest any painkillers for them. We only start medication for life modification and uric acid lowering drugs.
Lowering drugs. Okay.
So it depends on from patient to patient and the severity of pain. The main thing is it's better always to as soon as the patient comes with a severe pain, it's better to come once and to rule out whether it's gout, infection or any other problems. Very much history is very much important for us. The way how they present, if at all any recurrence is there, what to do, how can we prevent recurrent attacks.
Yeah.
So diet wise, I say to reduce the protein intake for at least short course. It's not proteins means like I was saying, like purines or what. Yes. So exactly non-vegetarian foods, red meat, mutton, chicken, or some fish. Prawns. These are more purine-rich foods, which will precipitate gout sometimes.
Doctor, can you explain that about the diet management more now?
Yes. First thing is hydration is very much important. As I was saying, more water needs to be consumed. That is first thing. And reduction of protein intake. And vitamin C diet is more important actually. So some people are alcoholics. I suggest them to avoid alcohol because in alcohol, beer, etc. are there, which will suddenly precipitate the gout.
Okay. Increase its chance of
chances of gout are precipitated.
Okay.
So obesity. So that's all comes under lifestyle modification.
Yes.
So diet wise and all, I prefer more antioxidants like vitamin C, ginger. So one more thing to be avoided is fructose drinks. Fructose. We feel only that proteins are important. Yes. We should avoid proteins. Not like that. We should avoid fructose also. Many of the sweet drinks what we consume in parties and all are more of fructose content.
Okay.
So the end product of fructose in one way is uric acid. So I suggest them to avoid cool drinks also. It's very much important.
Doctor, what about vegetables? Anything
Vegetables,
to be avoided?
one or two is better to avoid it. I mean, in some studies say, but as of now, I don't suggest any patient to stop vegetables. Vegetables, I think only like potato and all, they may increase uric acid.
Slight
some
chances
studies
only.
say, but I don't find much difference of with vegetables.
Okay.
I recommend carbohydrate diet. Okay, good, and even proteins also. I mean, like vegetable supplements. I mean, vegetable sources of proteins can be taken. They are not too much purine rich, or they may precipitate gout. I mean, there's some studies are there, but as clinically, I didn't suggest for anyone not to take any
Okay.
vegetables like that. Okay. I usually say them to take more of lemon juice,
Okay.
some diet supplements, and if at all any diuretics, if the patient is on diuretics, I'll ask them to change medicine like that. Some antihypertensives are there which will not precipitate gout, so I'll suggest them to switch on to that other medicine.
Okay.
So-
You have already mentioned about the medicines.
Yes, yes.
People are of the opinion that some medicines cause uric acid.
Yeah, yeah.
Is it?
So yeah, there are some medicines which will precipitate gout. Right? I was saying diuretics, some aspirin.
Aspirin.
Yeah,
Okay.
aspirin also. Some studies say that it will precipitate
There's a
gout.
chance. Okay.
So these are all long-term medicines. Okay. So and one more thing for diabetics, if the patient comes with diabetes and severe gouty arthritis episodes frequently, then we need to check the creatinine levels also.
Okay.
In diabetes, usually they'll be having renal damage. Suppose if we get any knee pain and the uric acid levels are high, then my suggestion is to check creatinine levels also,
Okay.
to check the renal profile. Sometimes even creatinine will be elevated.
Okay.
So, I mean, it's not like presentation will be one with joint pain, but the problem will be much more, which needs to be diagnosed properly. I mean, gout also present as a different symptom. It just indicates, I mean, is there any other problem with other systems also? So my suggestion is to check all the profiles.
Okay.
Once any gout, there is frequent episodes of gout sometimes. And sometimes even for tophi, like I was saying, some stone formation and all, we suggest some rare surgeries also to remove the stones from the joints and all. So there are many types of presentations. It's very common here in Arabic people, they call it as nakras. I mean, I'm new here, so I mean, before I say, they'll give me some. These things are very common for me, sir. So it will make my diagnosis easy sometimes. So, so more of the Bahraini population are having the symptoms of gout. Probably genetical factors, probably diet factors. It needs to be thoroughly evaluated, and we can prevent. You can prevent gout like lifestyle modification. Medicines, I mean, they need to take for a long time. They need to check some uric acid levels frequently. So I think some latest therapies like some biological therapy, what we call it as. There are some other medicines are there. I think still, I think Bahrain, we are not getting all the types of medicines here. I think some biological therapies are there, but I don't know whether it's available here in Bahrain or not. Still, the studies are going on that.
Okay, doctor, is this condition, the gout, is it a curable condition? Can we prevent?
It's not like we can call it as a recurrent condition.
Okay,
it's cured definitely. Patient will have good relief in a short span of time, but it will have recurrence. It may have recurrence. It will not have, but it may have.
Okay.
So to prevent recurrence, we need some modification. We need to check sometimes. Yeah. So all the things we have to get balanced.
Okay.
So many people feel that only our diet is more, our diet is some diet modification is required. All things are required. That's what I will say. I mean, it's not only the intake, but also elimination of uric acid is important from our body. So more of fluids or water has to be taken.
Okay. So you say it is curable for an episode, then it's there's a chance for recurring again.
Yeah. recurring episode, and sometimes chronic gout. I was saying they'll have some joint deformities, joint pain, swellings, and all. So for that we need some medication for long time.
Okay. And men are more prone to
Men are
uric
more
acid.
yes,
Okay.
as compared with females. men are
Any
more
reason for that, doctor?
There are many factors actually.
Okay.
For women, actually, after menopause, they will have, because some estrogen levels will naturally reduce the level of uric acid in women.
Okay.
It's not that men have some additional things. That's why it's not like that. So because of their hormones, uric acid will be in balance till the menopause. After menopause, probably the estradiol and all will decrease. That may precipitate gout.
Okay.
So there are multiple factors. Why exactly men will be more prone? There's still a lot of
Studies are
studies.
going on.
Yes.
Okay.
Lot of studies.
Okay.
So there are many pathways how the uric acid. Still, actually, some studies are going on for the latest treatments.
Okay.
So I think we have to update all the knowledge about gout.
Okay.
So as of now, from my side, I prefer some education first to prevent recurrent episodes, diet management.
Okay.
So if at all they get next episode of pain, then what should they do?
Okay.
So if any medicines are there causing gout, then they need to change the medication. So I suggest like prevention is always better.
But thank you.
So if it is like recurrent, then you should be more cautious.
Yeah.
Yes.
Any advice from your side for our viewers about this topic or any other relevant topic
Okay.
for a healthy lifestyle?
Yeah. So for a healthy lifestyle, especially in Bahrain, what I see is many people have vitamin D deficiencies.
Okay.
So deficiencies are very much prevalent here, and mostly many people are asymptomatic. It's not that they have symptoms. So, and this gout, this is all very, very prevalent here.
Okay.
And I need some patients to come for a health checkup at least once or twice in a year, so that they have some vitamin D check, vitamin B12, like random sugar, uric acid if possible.
Okay.
So my suggestion is to just to know the few things before we can get any symptoms. Okay. So this vitamin D deficiency and all, when it go for extreme, then we'll have some fatigability like that, some osteoporosis, osteopenia, some calcium disorders, etc., etc. It's like we need to check once. That's it. Okay.
Okay.
So,
Okay.
so I think my lecture will be little bit useful for the more population in Bahrain. So if at all they have any queries, or they can reach me at Al Hilal Hid. I'll be available in the morning and evening.
Sure, sure.
So thank you very much.
Thank you, doctor.
Okay.
Thank you for being with us in your busy schedule and spending a lot of time giving us a lot of valuable information about gout, its management, prevention, and also a lot of health tips. Thank you once again.
Okay, thank you very much.
So friends, I hope you found this episode quite informative. So if you have any symptoms of gout, please don't dismiss it as a minor ailment. Please seek medical intervention on time. As doctor told us, prevention is always better than cure. Stay healthy always. It's time to wind up the show. This is Jasila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, Meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.